Did you know that onions could be harmful to certain health conditions? Surprising, isn't it? Welcome to our exploration of the unseen dangers of onions. We often consider onions as an essential part of our culinary landscape, but for some, this humble vegetable can become a troublesome foe. Today, we'll delve into the health conditions that can be aggravated by consuming onions. We'll touch on Gastroesophageal Reflux Disease, or GERD, where the high acidity of raw onions can trigger heartburn and reflux issues. Then we'll discuss Irritable Bowel Syndrome, or IBS, where onions can exacerbate gas, bloating, cramping, and diarrhea. We'll also cover allergies, specifically onion allergies, which while uncommon can cause reactions like hives, itching, and swelling. We'll delve into a digestive condition called diverticulitis and how onions can be a problem. We'll even explore how onions can strain vocal cords and interact with certain medications. So let's dive into each of these conditions and why onions can be a problem. First up, we have Gastroesophageal Reflux Disease, better known as GERD. You might not realize, but the high acidity found in raw onions can be a significant trigger for heartburn and reflux issues. The kicker? This acidity can irritate the esophagus, leading to discomfort and pain. However, there's a silver lining. Cooked onions are sometimes better tolerated by those with GERD. So if you're suffering from GERD, it might be best to steer clear of raw onions. Next, let's talk about Irritable Bowel Syndrome, or IBS. Now, onions are a bit of a double-edged sword for those dealing with IBS. On one hand, they add flavor to our food, but on the flip side, they can exacerbate symptoms like gas, bloating, cramping, and even diarrhea. This is because onions contain fructans, a type of carbohydrate that can be hard to digest. So if you're dealing with IBS, it might be worth considering limiting your onion intake. For those with IBS, it could be beneficial to limit onion intake. Onions can also cause issues for those with allergies, diverticulitis, and vocal cord issues. Let's dive right in. Starting with allergies now, these aren't as common as you might think, but they do exist. An onion allergy could cause reactions such as hives, itching, and swelling. If you're allergic, avoiding onions is a must. Switching gears to diverticulitis, a digestive condition that often requires patients to follow a low-fiber or low-residue diet during symptom flares. This diet typically excludes vegetables that can be difficult to digest, like onions. And lastly, we have vocal cord issues. Singers, public speakers, or anyone dealing with vocal trauma are sometimes advised to steer clear of irritants like onions. The reason? Onions being acidic could result in increased vocal strain, affecting the quality of your voice. So if you're dealing with any of these health issues, it's worth considering your onion intake. Finally, let's discuss how onions can interact with certain medications. Did you know that onions can increase the risk of bleeding for those on blood thinners like warfarin? That's right, the compounds found in onions can interact with these medications, potentially causing excessive bleeding. It's a bit of a double-edged sword, isn't it? On one hand, onions are packed with health benefits, but on the other, they can complicate matters for those on certain medications. But it doesn't stop there. Some diabetes and blood pressure medications can also be impacted by onions. Because onions can affect blood sugar levels and blood pressure, they can interfere with the effectiveness of these medications, leading to potential health risks. It's a balancing act. Onions are a great addition to any diet, but like with everything, moderation is key, especially if you're on certain medications. If you're on any of these medications, it's essential to talk to your doctor about your diet, including onions. So we've covered quite a bit about onions and their impacts on various health conditions. We've learned that raw onions can trigger heartburn and reflux in those with gastroesophageal reflux disease. For those with irritable bowel syndrome, onions can exacerbate symptoms like gas, bloating, and diarrhea. Uncommon yet possible, an onion allergy can cause hives, itching, and swelling. It's crucial for those with this allergy to avoid onions. For individuals with diverticulitis, onions may be hard to digest and are often avoided during symptom flares. We've also discovered that onions can strain the voice, particularly for singers or those with vocal trauma. Lastly, onions may interact with certain medications like blood thinners and can affect some diabetes and blood pressure medications. Remember, while onions are generally healthy, they may not be for everyone. Always consult with your healthcare provider before making any significant changes to your diet. Stay healthy and informed.